want to give you an insight into how I was caught up in the shambolic contact tracing program in Victoria, which is increasingly looking like hotel quarantine Mark II. This week, I was ordered to quarantine for at least 14 days or face a $20,000 fine. In the end, I was only in quarantine for a couple of days, waiting for the overworked contact tracers and support staff to confirm what I already knew. They had the wrong girl. Not for the first time, the computer system the contact tracers rely on in this state had merged my file with that of a nurse at a major Melbourne hospital. And it was going to take some unravelling from the under-pressure staff dealing with this catastrophe in Victoria. My latest contact tracing mishap began with this text message on Monday, telling me that it was from the Department of Health and Human Services COVID-19 monitoring team, and was warning me that I'd been assessed as a close contact exposed to COVID-19 and would need to commence self-quarantine. I've got to tell you, my first thought was the text was a fake and that the link provided was a phishing exercise, particularly since the message concluded with these words. How do you know this message and link are legitimate? A DHHS Case and Contact Management Officer will have advised you to expect these notifications. Well, a DHHS officer had certainly not advised me anything of the sort. And given my previous experience with the contact tracing team a couple of weeks earlier, I knew this was likely to be another system error. In the meantime, I, of course, followed the strict self-quarantine guidelines, which wasn't that difficult given I spent half my waking hours on hold waiting to speak to someone who could tell me what in God's name was going on. On Tuesday, I got another message telling me to remain in quarantine. Before I was eventually set free, well, as free as you can be in a state where you need a permit to work and are confined to house arrest for at least 23 hours a day. But what's concerning me is that this case isn't entirely unique. I've since discovered it's not unusual for these text messages to be sent before a contact management officer has had a chance to call. Such is the backlog at the department. How many people who have received the message and should be in self-quarantine are disobeying the order because they do not believe it's a real message? After all, the message itself says you know it's legitimate because of the prior contact from DHHS. But far from more disturbing than even that is all those people who've been exposed to COVID-19 in Victoria but are not being contacted in a timely manner. Some are not receiving a phone call for many days, sometimes over a week. We know that COVID-19 is at its most infectious in the early days, so it is critical that every person identified as a close contact of an infected individual is contacted and quickly. But in Victoria, many people who should be isolating are unaware they've been exposed. Those working in the contact tracing team and call centres are doing their very best, but they are being let down by chaotic processes and poor leadership. We are 5 months into this pandemic and the Victorian response remains hopelessly inadequate. Dan Andrews' government rejected offers of ADF personnel from the federal government last month to assist in contact tracing efforts. Instead, the Victorian government again turned to the private sector. After all, that works so well with the hotel quarantine program. Premier Andrews has pledged to take full responsibility for the decisions that have plunged Victoria into a state of disaster. For those words to mean anything, he must step down. Andrews and his crisis cabinet have, through their inept decision-making, inflicted catastrophic medical, social and economic consequences. And for that, there must be a reckoning.